Welcome to Inside Ag. I'm your host, Erin Petersilie. As we start to approach the end of the year, health plans are starting to be reevaluated. Joining me today to talk about Kansas Farm Bureau's health plans is Erin Petersilie, the Assistant Director of Health Plans. Welcome, Erin.
Good morning, Savannah.
Can you tell me a little bit about the plans offered through Kansas Farm Bureau?
Absolutely. So Kansas Farm Bureau offers a variety of health options for all stages of life for Kansans. So we have 4 different options for those that are under the age of 65 that give them an opportunity to select things such as maybe different deductibles, different family plans, different out-of-pocket maximums. We also offer a dental and vision plan that is available for those at any stage of their life, and they don't have to have other products with us. So maybe it's just a matter of that's something that's missing from their group policy, and they feel like that's something that they want added in. They are welcome to do that. And then the last piece that we offer is our Medicare supplement plans, and we give them 4 options within our Medicare supplement plans to choose from as well.
And what's the difference between Kansas Farm Bureau plans and the plans that people can find in other marketplaces?
So we are a little bit different. For those that may remember, we went through the legislative process in 2019 to actually be able to change the offers of coverages here in the state of Kansas. So it's really important to know our terminology, that health insurance as by the Affordable Care Act or Obamacare says that we have to treat everybody the same. It doesn't matter whether they're healthy or not. If you're 34 years old, you're going to pay the same as the next 34-year-old. Where we are a health plan, we are an unregulated product, meaning we can ask health questions, we can rate people on the answers to those health questions, and we can potentially deny them at the end of the day based on the answers to those health questions. With that ability to rate, to really make sure that our group is healthy, it helps us then in turn save people money, and our members tell us that there are times they save up to 60% over what they would have purchased had they've gone out and purchased a traditional insurance plan.
And how do our Medicare supplements differ from other Medicare supplements?
So Medicare supplements, the great thing about them is that they are standardized. So it is really a matter of being able to compare apples to apples. So when you look at our Medicare supplement plan G, that's the most popular, it is going to provide the exact same benefits as any other company that is providing a Medicare Plan G. The only difference is going to be the cost of it and the customer service. How that plan pays, how that plan is accepted by the doctors and hospitals is going to be the same across the nation. They're simply getting to compare, again, like I said, price and customer service.
Other companies have different enrollment periods. What's the enrollment period at Kansas Farm Bureau?
So at Kansas Farm Bureau, because we are an unregulated product in that under 65 market, it allows us to have our open enrollment period all year round. So while many people are in the marketplace, and that marketplace, the healthcare.gov opened up for open enrollment period of November 1st through December 15th, we are open all year round. We still encourage people, you need to find what works best for your family. And if it's best for you to go to the marketplace, we definitely don't want you to miss out on that enrollment period. But you can come to us at any point in time without having to have any sort of special enrollment periods like you experience in other markets.
Awesome. And for people that want to get enrolled, how do they get a quote and apply?
So there's 3 different ways that people can get more information. First off is our website. For those people, it's KFBhealthplans.com. That will allow them to get a quote. Anybody is welcome to go on and get a quote, whether they're a Kansas Farm Bureau member or not. If you want to apply, though, you have to become a member. So that does have to be a paid membership if you want to go through the application process. But anybody can go on, check out our plans, see the schedule of benefits, etc. If you prefer a more in-person approach, every local Farm Bureau office is equipped to be able to walk in and be able to ask some questions of how these would work and guide you through the steps. And then the third way is to call, and we do have a number. It's available on our website, and it's also out there with the agents that you can call our hotline number. It gives you our partners in Tennessee, and they can walk through questions with you or that application over the phone as well.
Awesome. Erin, is there anything else that listeners need to know about health plans?
I think the most important thing to know is that every day we continue to grow. We cover over 16,000 lives in our, since we started in 2020, being able to actually cover people. It's important to know that really look at all your options, whether you're looking at us or another market like we mentioned earlier. Really look into the fine print, comparing your deductibles, etc. But some of the cool things that we do offer is we're not limited by the border of Kansas. So if you want to, or you're traveling or whatever, and you need to seek coverage outside of the state of Kansas, that is perfectly fine. We are a nationwide network. Also, if you choose to leave the state of Kansas and move to another state, then you are welcome to take your coverage with us. So that ability to be portable and that no defined service area, that gives us a huge advantage that other markets do not have.
Thank you, Erin, for joining me on Inside Ag and giving our listeners a look at all the health plans available to Kansas Farm Bureau members. Again, I'm Savannah Peterson on Inside Ag. If you like this episode, be sure to share it with your friends.